Bonjour et bienvenue à cette conférence de presse.
Good afternoon. Welcome to this press conference to provide an update on COVID-19 in Quebec. The press conference will unfold as follows. Minister Christian Dubé will speak to you, and then there will be a question period from the media, and Public Health Director Horacio Arruda will also be available to answer questions during the Q&A period. Without further ado, Mr. Minister.
Merci beaucoup, Marjorie.
Thank you very much, Marjorie. Hello, Dr. Arruda. Hello, everybody. Over the past few weeks, the situation with COVID in Quebec is worrisome. We see the cases increasing, and we are now on a plateau of approximately 1,800 cases a day. We have often repeated ourselves. When the cases increase, hospitalizations and deaths also increase. The situation is critical in hospitals. Yesterday, we reached 1,000 hospitalizations for COVID patients. We've got capacity of 2,164 beds, which are dedicated to COVID patients, and that includes intensive care. So if we continue in this way, we will go beyond our capacity. So the situation is already critical in certain hospitals in Quebec. And to be very transparent, I will give you the list of the hospitals. So first, Chicoutimi in the Lac-Saint-Jean region, the CHUC Enfant Jésus in Quebec, Trois-Rivières, the MCQ, Hôpital Pierre-Boucher in the Montérégie-Est, Anna-Laberge Hospital in the Montérégie, Lakeshore Hospital in the West Island, the Verdun Hospital in Centre-Sud, in Hull, the Outaouais Hospital, ECPQ in Quebec, and the CHU in Sherbrooke. So 10 hospitals are in a critical situation currently for COVID beds. Which brings me to talk about the delay in activities. Now, in several regions, we had to increase the delays of activities to be able to provide care for COVID patients. That means that almost all activity sectors could be impacted. For example, decreased surgeries, external clinics, outpatient clinics, front lines, and rehabilitation. That's where we are. We even had to prepare some beds for COVID patients in sites that we call non-traditional because we are missing beds in our hospitals. For example, in Quebec, we've installed some beds at the Concorde Hotel. We will even have to use some reception rooms in the hotel for beds. Before going to the emergency department, I would like to remind you of a few messages to avoid these delays in services. And this is what the healthcare network has asked me to communicate to you. First of all, we have often said this. Everybody can contribute to decreasing the pressure on our healthcare system. I want to remind the population that they should go to the emergency or to the clinic only if it's truly necessary. For example, people who have a family doctor can communicate with that doctor first. Any person who does not have a family doctor, for example, can dial 8177-644-4545 in order to be sent to the right resource, and that is important. When the clinical need requires it, the consultation could be done remotely. We have the equipment for that now. At all times, it is possible to communicate with 811 in order to get some clinical advice from a nurse at InfoSanté. All of these measures are important so as to not have too many people in our emergency departments during the holiday season. Now, a few points on the measures during the holiday season. The increase in hospitalizations that I just mentioned, but not puts pressure on our healthcare network, but also on our staff. I want to speak to those who are thinking about not respecting the rules. Our healthcare network and our staff cannot afford a surge in cases after the holidays. If Quebecers do not respect the measures during the holiday season and multiply their social contacts, unfortunately, we will hit a wall in January. We must be We will have to delay even more activities in our hospitals and delay some surgeries that could be urgent. So please think about the people who could have their surgery postponed because some people did not respect the public health measures during the holiday season. In conclusion, think about all of those who have been on the front lines since last spring. Think about these men and women who are making sacrifices every day to save lives. I would like to send this message to all Quebecers. Let's show solidarity during the holidays. Let's show solidarity for our staff in the healthcare network. With the Premier and my colleagues, Dr. Carman and Mrs. Blais, we have joined our voices in a video that is addressed to the staff in the healthcare network. So I want to take this opportunity to thank them once again and to invite all Quebecers to think about those who will be working during the holiday period. Thank you very much.
In recent weeks, the COVID situation in Quebec has been worrying. Yesterday, we crossed the line of 1,000 hospitalizations for COVID patients. The situation is critical in some hospitals. We have had to prepare beds for COVID patients in what we call non-traditional location because we lack beds in hospitals. I want to remind the population to come to the emergency room or to a clinic only if it is really necessary. The increase in hospitalization is not only putting pressure on our health network, but also on our staff. I want to speak to those who think about conturning the rules. If Quebecers do not respect those rules during the holidays and increase the contacts, have a thought for all those who have been at the front since spring. To those men and women who make sacrifice every day for you. I would like to send this message to all Quebecers. Let's stand together for this holiday season, show solidarity for our staff and in the health network. Thank you very much. Merci beaucoup.
Alors, nous allons maintenant passer.
We will now go to the question period.
Donc, comme nous sommes,
Since we are online, we will open the microphone to reporters who raise their hands. We will begin with questions in French. It's a question and a follow-up question, and please,
avoir une personne qui représente
only one person per media.
personne qui adressera sa question, Véronique Prince, Radio-Canada.
Question.
Est-ce que vous m'entendez bien? Ça va?
Oui, Madame Presse, on vous entend bien.
Yes, go ahead.
Je voudrais savoir si
I would like to know if the current situation is bringing you to review your priorities when it comes to vaccinations. Should we immediately start to vaccinate workers in hospitals? Listen, it's a recommendation that was very clear and it came from public health, and it rests on a recommendation from the vaccination committee. And it was very clear, and we will follow these recommendations, that the most vulnerable people were the ones who are residents of CHSLDs and the staff in CHSLDs. It's obvious that when we will have enough vaccines, and we can move on to the next group. But for the time being, with the next doses that are coming in next Monday, we will continue to focus on the staff in long-term care homes and the patients.
je voudrais justement continuer sur la vaccination.
Now, on vaccination again, where are we with training for the 30 professions that you have called upon to contribute? Has this started? Will we be using them soon? What is the sequence concerning these new people who will be able to administer vaccines? I will have an update on this immediately after the press conference with Mr. Daniel Raté to see where we are with the training. Clearly, there are some groups that don't need much training or any training at all, but I would like to give you more details at the next press conference. Right now, it's mostly the usual vaccination staff that is handling that, but we have to be able to ready when we will have a significant increase in the doses. So I will have an update on this from Mr. Raté this afternoon.
Nous allons maintenant passer à M. Patrick Belrose du Journal de Québec.
Question.
Pardon. Oui, bonjour à tous les deux.
Hello.
Je sais pas si j'ai bien entendu.
I don't know if I heard correctly. I understood that there were 2,400 COVID beds in Quebec.
Donc, juste préciser, et si c'est bien le cas,
And if that is the case, 2,400,
expliquez peut-être un peu pourquoi la situation
perhaps explain to us why the situation is so critical if we're at 1,000. I understand that it can increase quickly, but why?
importante qu'on pourrait le croire.
Why do we not have as much capacity as we think we do? Well, first of all, it's because there are some regions that are more impacted than others. And what we have to understand is that the speed at which the situation could deteriorate, remember that 2 weeks ago, we were at 500 beds that were occupied by COVID patients, and within about 10 days, we went up to 1,000 beds. So I think that it is our duty to be prudent and to be ready. We talk about this every day. I think that we've asked all of our staff under the direction of Dr. O'Patterney to get ready for the worst-case scenario. But we have the capacity for 2,000 beds, over 2,000 beds. But every time that we free up a conventional bed for a COVID bed, we're talking about surgeries that are postponed or treatments that we are postponing. So it's not just the capacity that we have, but the fact that we will have to postpone some services in sectors where people have a right to be treated. And unfortunately, we will have to postpone their treatments. When we see the current numbers, and we know that it always takes 2 to 3 weeks before it has an impact from a measure, we have the impression that it's impossible to not go back to a certain lockdown. I understand we're going to have a break during the holidays, but do you think that you will have a more significant lockdown given the increase of the past few days? I would answer you what we've been saying since the beginning, Mr. Belrose, and that is that nothing is excluded. I think that that's the best answer that I can provide you today. But I would like to tell you as well that having reached plateaus a few times, like we had a plateau of 1,200 previously, now we've got a plateau at 1,800, which seems to be stabilized. I'm very anxious to see in the next week, well, the additional measures that we have added, if we think about what we did in malls to limit the traffic there, the foot traffic, the measures that we've announced this week, I think that we have to start by concentrating on what people are doing. And if there is a message that I would like to reiterate today, it is that it's every one of us. And when I say every one of us can make a difference, and when I said earlier, and I really want to weigh my words well here, it's not to try to find a way to cheat that's important. What's important is that I want everybody to be conscious of the fact that when we deviate from a rule, we can have an impact on a bed that we will take away from somebody else. And I think that we're starting to see this. People are starting to understand that when we are at 1,000 hospitalizations, there are some surgeries that will not be done because somebody did not respect the rules. So what I would tell you today is before seeing what we will announce on the 11th of January, we can make a very big difference by the 11th of January. I know that we've been repeating the same message for several weeks, but please, before thinking about violating the rules, please think about those that you should be thinking about so that you don't send them to the hospital, please. Sorry, Mr. Belrose. We will move on to the next reporter. Question.
Est-ce que vous m'entendez bien?
Can you hear me? Yes.
Pardon. Alors, j'aimerais savoir,
I would like to know, Mr. Dubé or Mr. Arruda, we talked about what's happening in the health settings. The NSPQ is also going to do a study as to why there's so much contamination. What will the government do? Will there be some measures deployed in the health settings? Because even if there are protection measures with the equipment, amongst other things, the virus is still being transmitted. Well, I'm not sure that I understand. When you mean additional measures? Is that your question? Well, the NSPQ is looking at the fact that there's many healthcare workers getting infected. Are there measures in place? Will the government look at additional measures to change this trend, because it doesn't seem to be improving in hospitals? I'll let Dr. Arruda comment on this. Yes, if you'll allow me. We have to understand that the NSPQ, as they've done in the spring, they will do a study to see where people were contaminated. But you'll have to understand that all the measures that are recognized scientifically speaking, that is prevention and control measures, the practice guides, etc., what we've noticed as well is that when there's a lot of transmission in the community, people also get infected in the community, not necessarily in the healthcare setting. And what we've noticed is that while people are providing care, there's no problem. People apply the measures and all this. But often, as soon as they go on break or in a room with their colleagues, well, it's human nature. They forget about certain measures, and then there's contamination. What will be done in this study, they're going to see what are the factors, and it's very clear that in the second wave, we are not at all in the same situation as in the first wave. People have material, people were trained, people are audited, we make reminders, but what's happening here is happening throughout the world. It's a small virus that is very dangerous, and I also want to mention, as our minister said, it's a virus that's not going to go on break during the holidays, right? It will still be there everywhere, and that is why it's important to respect the rules. This measure will help us perhaps to identify some factors, and particularly to readdress the messages to our staff so that they don't forget to respect the rules and measures.
Maintenant, Marie-Michel Sioui, Le Devoir.
Question?
Oui, bonjour à vous deux.
Hello.
Le 8 décembre, au début du mois de décembre,
At the beginning of December, the government was saying that you were getting ready for the worst case scenario. You were getting ready to postpone around 50% of surgeries. At that time, Mr. Dubé, you said that it would be possible that the postponements would go up to 70% if the situation did not improve. So I wanted to know today, what percentage are we at? Have we reached the 70%? Have we gone beyond it? We haven't yet reached the 70% of postponements. Actually, we had to postpone on average, and that's why earlier I gave you some examples of the 10 hospitals that are most impacted. We had to postpone 20 to 30% now. We're at a situation where, I'll summarize because I think that it's important to have an average, but I had indicated that day that we were at around 80% of our capacity, you'll remember. And we had said the first movement that we should do is to remove approximately 30%. So we should be able to be at around 50% capacity. Right now, there are some hospitals that have little or few postponements. Others have a bit more than 30%. So we're already at around 50 to 60%. Now, what will be very difficult, and we want to avoid this, is when we go below 50%, if we have to go even further. So if we went from 1,000 beds to 2,000 beds, as mentioned earlier, well, that is where it's going to be very painful, and we want to avoid this. We know quite well where we were on the 8th of December, and we know that today we've reached perhaps 25 to 30% postponements on average, particularly in the hospitals in the urban centers, Montreal, Quebec, and Sherbrooke. But we don't want to go below that. And that is where the population, that's where Quebecers can make a big difference over the next 2 to 3 weeks. Thank you. On the vaccination, I'm going to come back to Véronique's question. We understand that the order of priority was determined by public health. But can it be changed, this order? And also, if we get more doses than expected, would it be possible to change what was planned from the beginning and to vaccinate staff in hospital settings? There are two elements in your question. So the number of vaccines and the speed at which we will get them. Now, the number of vaccines currently is very, very limited. As you know, we talked about 4,000, a little bit more than 4,000 in the past week, which will be used in the next 2 days, and approximately 50,000 between the 21st of December and the 4th of January. It's a very limited number of doses, and of course, with these limited quantities, the focus is on patients in long-term care homes and the staff. Obviously, when we will have a confirmation, and I hope that will come quickly, that as of the 4th of January, we would have greater quantities of the vaccine, well, we will finish vaccinating our vulnerable populations, the staff that care for them, and then afterwards we'll be able to go to healthcare employees. But it's really a question of the number of vaccines and the speed at which we get them. And I would add to this, and I don't know if Dr. Arruda wants to add something, but what we're all following is Moderna's approval in the next few days. We saw that they've obtained it in the U.S., and I hope that we will get some good news in Canada. Three elements. First, we have to understand that we did a list of priorities because we wanted to protect those who die or get complications. That's very important. Secondly, we have to understand that even if we have a list, 1, 2, 3, 4, 5, 6, 7, 8, there are some people who will be vaccinated depending on the number of vaccines that we get. So we're not going to stop everything. We'll probably have some approaches that will allow us to vaccinate several people. And I think that in the end, you have to understand that this vaccine has not demonstrated that it stops the transmission to somebody else, but it's there to protect the individual. And that's why it's important to vaccinate our elderly people and people who are at risk of complications and death. And healthcare workers as well, we will do it, but they won't necessarily have a death rate like the elderly. That's why we have this sequence. We now have a written question from Annie Guillemette, Cogeco. Yesterday, the mayor of Montreal asked citizens to call the police if they see illegal gatherings. Is the situation critical enough to encourage this? Well, I appreciate the question. I think that I can answer that the best thing to do is to not have any parties. All right, before we think about denouncing parties, the key message today, and I hope that all Quebecers will understand this, even if we don't make any friends by saying this, please respect the measures. I heard, and I'm going to use this example, that orders at the SAQ are off the charts right now. But that's not a good sign. And those who have already bought their alcohol to have parties, well, keep it for later, please. However, if there are some people who witness gatherings or parties, and please do not be shy to denounce them. But the first thing we have to do is to not have any gatherings, please. Question?
Oui, bonjour.
Hello. Can you hear me? Yes. I wanted to hear you about the screening, the pace. If I understand the graphics well, the number of people who get tested has been pretty stable over the past 10 days approximately. And I was wondering if we should not have expected an increase in the number of people who want to get tested. I'd like to hear you on this. We can't see you, but we can hear you quite well. I appreciate your question. Well, first, I would like to take this opportunity to thank our staff because we had a record number of tests yesterday with over 39,000 tests. And I would like to say we saw a certain increase in tests over the past week. And I think that's good news because you'll remember that a week ago we had asked people to not hesitate to get screened because we had noticed that people were not getting screened quickly enough. And the quicker we get screened, the more we can control the situation and do the contact tracing. So I think it's good news that even with 39,000 tests, we have 1,800 cases, so that's relatively good news. And I would say that we don't have a lack of tests, right? If we could do 42,000 or 45,000, obviously it's more difficult, but our staff is already there, and that's why I thank them. Because if there's more people who want to get screened, we will be able to test them. And this will allow us to do better contact tracing to control the outbreaks.
En sous-question, Madame Lachapelle.
Follow-up question?
Nous allons maintenant...
We will now go to Zachary Goudreau, Journal Métro. Question?
Vous m'entendez bien?
Oui.
Go ahead.
En fait, je voulais
I wanted to compare the situation in Montreal versus the other regions. I see in the list that there are 2 hospitals in Montreal that are in critical situations. You said, Mr. Dubé, that there are some regions that are more impacted than others. Montreal versus the rest of Quebec. How's the situation? Is it more or less critical? Can we compare the region of Montreal with other regions? What we often look at, and Dr. Arruda can add to this, but we often look at Greater Montreal region because it's important to look at the island. But earlier when I was talking about, for example, Pierre Boucher Hospital in the Montérégie, Anna-Laberge Hospital, these are hospitals that are very busy. The South Shore, Laval as well, and I'm adding Lakeshore Hospital and the Verdun Hospital. So I would say that in our main hospitals in the Greater Montreal region, there are 4 out of 10 that are critical. The region of Quebec, we can't forget it. Perhaps Dr. Arruda can comment to this effect, but the region of Quebec, our big centers. From what I've named, I had 2 hospitals in Quebec. I had some hospitals in Trois-Rivières and some hospitals in Sherbrooke. So it's our big centers, and that's where we have to be careful. Dr. Arruda, I don't know if you want to add. There's risk everywhere in Quebec. We have to remember that. But as the Minister said, there's community transmission, the urban centers where there's a lot of people. In Montreal, the Montreal area is very impacted right now, and it's the same thing for the city of Quebec. So clearly, this cocooning break will be major, and that will help decrease this community transmission. And now is not the time, as the Minister said, to try to cheat the rules, because the virus will not cocoon. It is here to stay. Without going into too much detail, I'll give you some stats to remember. Just in Montreal, there's 900 people who are doing contact tracing right now. 900 people who every day are working to follow the outbreaks because there are cases. So let's remember that. There are some people currently in the healthcare network, people who work in hospitals and elsewhere, but just in public health. In Montreal, there's 900 people who are doing contact tracing. Now, as to the bed capacity, we're hearing that the healthcare network in Montreal is perhaps more solid than in other regions. Now, when it comes to the capacity of beds, will there be an overflow in Montreal? Or? We often talk to Mrs. Roy, and I think that she would answer that let's not take any chances. Currently, we're doing okay, but if we look at the speed at which the virus can be transmitted, I would tell you that Montreal, Quebec, Sherbrooke, the Outaouais region, everybody is fighting against the same virus, and let's be prudent.
Maintenant, Stéphane Blais, excusez-moi, de la presse canadienne.
Question.
Est-ce que vous m'entendez?
Oui. Oui, oui.
Ah, merci.
Go ahead. Can you please name the 10 hospitals again, the ones that are in a critical situation? I will go quickly. Chicoutimi, Chuc in Quebec, Enfant Jésus, Trois-Rivières, Pierre Boucher Hospital, Anna-Laberge Hospital, Lakeshore Hospital in the West Island, Verdun Hospital, in Hull, in the Outaouais, the ECPQ and the CHU in Sherbrooke.
Je vous ai perdu dans la liste.
I lost you in the list. I didn't have time to note it all. Is that online somewhere? Yes, it will be online immediately after the press conference.
J'ai une autre question.
I've got another question from my colleague. She would like to know, there are representations that were made to you recently concerning the accompaniment for people who have cancer. Mrs. Pomerleau and Mr. Jasmin asked us to allow the accompaniment in all waiting rooms in the province and in treatment rooms. Has anything happened there? Well, there are two things that happened. First, I had explained that we have to make a distinction between waiting room and treatment room. In the waiting rooms, unfortunately, there are a few places where there was no waiting room. We have asked our CEOs to correct the situation when it's possible, but we cannot prohibit a caregiver to be with a patient in the waiting room. So if there were places where that rule was not applied, we asked our CEOs in this CIS and this CIS to correct the situation. People can accompany cancer patients in the waiting room. Now, we cannot change a rule for the treatment rooms. That is, we understand, and we understand because we've got two recommendations, specific recommendations, to not accompany people in the treatment room because the COVID risk is very, very high. So it's a question of safety, but to answer your question, we made sure that at the very least, patients can be accompanied in the waiting room. And if there are institutions that do not have a waiting room, we will try to correct the situation.
Maintenant, nous allons passer aux questions.
We will now go to the English questions.
Montreal Gazette.
Good afternoon. Can you both hear me?
Yes.
Mr. Dubé, healthcare workers are telling us that they're exhausted and they can't keep going like this. What can be done to help them? And are you considering asking for the Red Cross or Army to help at this point?
Well, as I mentioned, I think the best way to help our healthcare workers is to follow the sanitary rules, because that's the way we will decrease the pressure on the health system. And I think that each Quebecers owe that to our workers. That's the first thing, because this is in our hand. We've said it for many times, but I think it's important before this period to repeat it. Now, we already use some of the personnel of the Red Cross. I think that's we use them in some location, but I don't think we are at this stage now for the Army. But as we said, nothing is excluded. But for now, I think we should rely on following the rules to make sure that we limit hospitalization at the level they are right now.
Thank you. And a follow-up question for Dr. Arruda, if possible.
Yes.
Dr. Arruda, today we see that the airport is crowded with passengers traveling home for the holidays. Are you concerned that such large groups at the airport could risk spreading the virus? And are you worried that travelers could also lead to an uptick in cases here?
Yes, it's a very important issue. You remember what we have had in springtime when people came back from other countries where the virus was there. We are working actually with the federal government to see what is going to be the measures that's going to be put in place. First of all, we do not recommend any travel outside of the province if not needed. But we know that some people are going there for Christmas time and will probably be under the sun having parties and everything. So we will make sure that we're going to be applying and work with the feds to respect the quarantine, which is supposed to be done. And there is some also pilot projects looking at the possibility to screen and make sure that people will, when they will come back, they're going to stay for 14 days at home. So I think it's a very important issue you're telling. And please, I'm just asking if it's not the time to go to party elsewhere in the world, because over there is also the virus.
Maintenant, Angela McKenzie, CTV.
Can you hear me well?
Yep.
Yes, we do.
Yep.
Great, thank you. For Minister Arruda, I understand that right now the priority for vaccination is residents and healthcare workers in the CHSLDs. However, for the priority list as a whole, the Teachers Association sent a letter to the province last month asking to be bumped up on the vaccination list. They say they've never heard back, and they also say it's not clear where they stand on the list. Can you clarify?
First of all, as I explained, we are protecting the ones who are going to die or have been hospitalized with this. I understand everybody is concerned. There is going to be enough vaccine for everybody in Quebec, but there is a stepwise approach related to the quantity of vaccine. So it's why perhaps in this big list, it's difficult to see exactly where we're going to be are. But that will depend on the quantity when it's going to be coming. So I think the first 3 months is going to be the most challenging thing. In the second and the last 3 months, mostly everybody is going to be vaccinated. So we cannot even answer the question exactly now because we don't know how many vaccines we're going to have in January, February, March, April, and this is absolutely necessary. But we will keep the same principle, protect the ones who will have a higher risk and the ones who are working in essential services.
Okay, thank you.
Maintenant, Sid Banerjee, Canadian Press. Sinon, nous allons passer à Elias Aboud, CBC.
Hello, Dr. Arruda, Mr. Dubé, can you hear me?
Yes, we do, even if you are with us here in the room.
I wish I were there, thank you. I just wanted to ask, first of all, Mr. Dubé, could you explain at what percentage we are right now? I'm not sure the English term for the délestage, the easing off on surgeries. Where are we now as a province with the amount of surgeries we've had to ease off on at this point?
I'm saying I answered the question earlier, and I said that we went from operating at roughly 80% 2 weeks ago to, on average, about 50%.
Okay, and as far as selecting which areas will get vaccinations starting Monday, especially in regions where COVID has not been a huge factor, how did you go about selecting which areas will get those vaccinations starting Monday?
We thank you for the question. We have published yesterday a list of 20 locations that cover Quebec fully. Out of that, I think the great majority, I think, are CHSLD, and they are in all the 16 regions of Quebec. An additional site in Montreal and in Montérégie. So I think we're covering very well Quebec when we receive the vaccine on Monday.
Et nous allons maintenant passer la parole pour la dernière question. Gloria de Global News. Gloria H. de Global News.
Good afternoon. Can you hear me?
Yes, we do.
Yes.
Thank you. So still on the topic of vaccines, what are the priorities when it comes to vaccination rollouts over the holidays? Who is next and where?
Yeah. We have listed 20 sites that can be ready to roll on Monday. If we have the same success and velocity that we had this week, I hope that we can do very quickly our vaccination. The program, and I think Pfizer has been keeping their word. Last time they said we would receive it on Sunday, and they were right. We received it, and Monday morning we were able to vaccinate. So let's cross our fingers that we will have good news this coming Sunday. We will be ready, and to vaccinate as many vaccines that we'll receive during the next few days. But the number that we have in mind, and this is a very important number, is roughly 50,000 doses between December 21st and January 4th. So that's a lot of people that we can put on our list right now.
And who is on that list? Who would be next?
The next is mostly people that are patients in CHSLD. That's the reason, and all the sites that we published on our website yesterday are mostly CHSLD. So not only the patient, but the employees that are working in those CHSLD.
C'est ce qui met fin au point de presse virtuel à leur journée.
And that is all for the press conference. Thank you all for your collaboration. Thank you, everybody. And please be careful. Thank you. And don't forget, no parties.